I am Alicia, a licensed pharmacist and health educator. I have over 25 years of experience in the pharmacy and healthcare industry. Welcome to Informed Consent RX Real Talk. In this video, I'm going to talk about the very popular GLP-1 medications that are on the market today. Going to hit the highlights and tell you some things that you probably already know, but I'm also going to tell you things that maybe your doctor did not tell you about the medications. Why? Because I believe that patients should know the benefits as well as the real risks of the medications that they're taking. You need to know the good, the bad, and the ugly. Feel free to comment your experiences with these medications or ask questions in the comments below. Ready? Let's talk. GLP stands for glucagon-like peptide. These agents mimic a naturally occurring hormone that's found in the gut or the GI tract. It's usually released in response to a meal. They work by either stimulating the release of insulin from the pancreas, which results in a lower blood sugars in the blood. Also, they block another hormone called glucagon, which works the opposite of insulin. Glucagon tends to raise blood sugar levels, so the GLPs block glucagon. They also slow digestion by delaying gastric emptying. This will prevent blood sugar spikes after meals, which helps you to feel fuller sooner and longer, decreasing your appetite. FDA has approved a number of GLP-1 agonists. The most commonly prescribed would be the Ozempic, and the active ingredient in that is semaglutide. And semaglutide can also be found in Wegovy and Rybelsus. We also have dulaglutide, which is found in Trulicity. Also available is liraglutide, which can be found in Victoza and in Saxenda. We also have exenatide, which is found in Byetta and Bidurion. And last, we have Alixin, which is lixisenatide. Medications are used in the treatment of type 2 diabetes, also in the management of weight in adults who have been diagnosed as obese or overweight. They're also used to reduce the risk of worsening kidney disease and heart attack and stroke in patients with type 2 diabetes. These medications are not intended to be standalone treatments. They should be used in conjunction with your exercise and diet. And doses for weight loss typically will be higher than dosages that are used in type 2 diabetes. Why do physicians like these medications so much? Because of their effectiveness and cardiovascular benefits for their patients. They improve the overall glycemic control, they lower the A1C, they reduce the risk of heart attack, stroke, and even death in these patients with type 2 diabetes. They also slow the decline in kidney function and renal failure. It causes a significant amount of weight loss in patients who are at increased risk for heart and kidney disease. So, the overall health benefits and health outcomes for type 2 diabetes patients is dramatically improved on these medications if they can tolerate them. These agents are available primarily as a pre-filled syringe for injection. However, semaglutide is also available in an oral dosage form as Rybelsus, and there's a new Wegovy pill that just got approved here recently. But the syringes are administered by subcutaneous route once a week, and it can be administered with or without food, but they should be administered the same day of the week. So whichever day you choose, make sure that you're injecting your next dose on that same day of the following weeks. Now, the time of day does not matter. Doses are typically titrated every 4 weeks, meaning they are gradually increased up to a dose where the glycemic control has been reached. Again, these are injectable medications that should be administered subcutaneously, meaning they should be injected in the fatty tissue under the skin. You want to inject it at a 45-degree angle. Possible injection sites are the abdomen, the upper arm, or the thigh. You want to be sure to rotate the injection sites, which means you're going to use a different injection site each week. You may rotate within the same region, or you can rotate to another area altogether. This will help reduce injection site reactions like the hypergrowth of tissue in that area, or hardening in that area, or a loss of fat in that area. Always inspect the medication before you inject it. The solution should be clear, colorless, and free from particulate matter. If it's cloudy or if you see anything floating in it, do not use that pen. Discard that one and use another one because it should be clear, colorless, and free from particulate matter. If you also take insulin, you must give insulin as a separate injection. You cannot mix insulin and the GLP-1s together in the same syringe. It is, however, acceptable to inject them in the same region of the body, but you should not inject them side by side. Talk about how you should store your pre-filled pens. Of course, you want to store them in the refrigerator before you use them. But after you use a pen the first time, then you can store that pen at a controlled room temperature, and from 14 to 56 days, depending on which GLP-1 agent that you're using. Or you can put them back in the refrigerator. But once you start using them, one of them, that one pen that you're using, it does not have to be refrigerated. You can leave it out at room temperature. Some of them are for 14 days, and then I think there's one that you can even leave it out for up to 56 days. But you want to store the pens without their needles attached. So once you inject the medicine, you want to discard the needle. Do not reuse the. Now let's talk about the more common side effects that are associated with these agents. As you can see on this slide here, that the majority of these are going to be related to the gastrointestinal tract. They can be mild, they can be moderate, and in some cases they can be severe. They are typically dose related and sometimes it's agent related. So if you can't tolerate one, the doctor may try you on a different one or just have you discontinue the medicine altogether. So just talk to your prescriber if you notice that you have nausea and vomiting that won't go away, severe diarrhea, constipation, persistent, and abdominal pain. Now, if you have too much vomiting, it can lead to dehydration, or too much diarrhea can lead to dehydration. So you want to stay hydrated because dehydration can lead to kidney problems if not managed. Now that we've talked about the common side effects, I want to share with you some of the potential more serious reactions that you may not have been warned about. So while they are rare, it is important that you are made aware of them because some of them can lead to some long-term organ damage. The first is pancreatitis. This is an inflammation of the pancreas. It can be acute or it can be chronic. It can also be mild and then it'll resolve. But it can be severe enough in some patients where it leads to pancreatic cancer. Various signs and symptoms of pancreatitis include abdominal pain in the upper stomach area or abdomen, and this pain typically will radiate to the back. The pain gets worse after eating. You also might experience nausea and vomiting that's a little bit more severe. In addition to that, have bloating, or oily or greasy stool, as well as a fever, a rapid heart rate, and yellowing of the skin and eyes, which is called jaundice, and just an overall feeling of weakness. If you notice any of these, you want to reach out to your provider. These medications can also affect the gallbladder, causing gallstones, and symptoms of gallstones are going to be similar to the same side effects or signs of pancreatitis. So they're going to kind of overlap. You'll get that abdominal pain, but this time the abdominal pain is up in the upper right abdomen. It will also radiate to the back, but you may notice pain in your right shoulder. It can cause the nausea, the vomiting, fever, sweating, indigestion, and then the jaundice, just like in pancreatitis. But just pay attention if the pain happens to be mostly on the right upper part of your abdomen and you got shoulder pain, then it's probably gallbladder related versus pancreas related. These agents can also cause intestinal blockages or obstruction, and if you have persistent constipation, that will be a sign of that. So if you have any of these signs, you want to reach out to your healthcare provider. GLP-1 medications can also affect your eyes. It can cause or worsen a condition called diabetic retinopathy, which is a disease that affects the blood vessels of the retina of the eye, leading to vision loss or complete blindness. So the signs you want to look for are going to be changes in your vision. Any changes, noticeable changes in your vision, like blurred vision, wavy vision, floaters, if your night vision has gotten worse, or you have impaired color vision. So contact your prescriber if you notice any changes in your vision at all. Medications can also cause hypoglycemia or low blood sugar when used with other medicines that lower your blood sugar. So if your doctor has you on something like a glipizide or glyburide or insulin or any other medication that was designed to lower your blood sugar, mixing it with a GLP-1 agonist can increase your risk of hypoglycemia. So the various signs that you would look for would be dizziness or lightheadedness, rapid heartbeat, sweating, shakiness, chills, excessive hunger or feeling hungry, pale skin, nausea, and then just changes in your mental status, impaired mental status, not being able to think or being a little angry. Um, these type things. So any change in your mental status could be a sign of a dangerously low blood sugar. So you want to be sure that you're monitoring your glucose levels if you are on a GLP-1 and an insulin or another type medicine that lowers blood sugar. There's also a risk for thyroid cancer. There's a boxed warning within the prescribing information from the manufacturer that says there is a risk for thyroid cancer with these medications. Now, this is rare, but it was documented in the animal studies in rats. So if you or a family member has a history or of thyroid cancer, then you cannot take this medicine. It is contraindicated in people who have a family history or a personal history of thyroid cancer. But just be aware that if you have a swelling in your neck or a feeling like something's growing in your neck, you're having trouble swallowing, shortness of breath, or you have a persistent hoarseness, you want to reach out to your doctor immediately. Another serious risk associated with the GLP-1 agonist is what's called pulmonary aspiration. This occurs when the stomach contents are accidentally inhaled into the lungs. This happens when patients are under anesthesia or heavily sedated. Remember, GLPs significantly slow down stomach emptying, which means you'll have food hanging around in your stomach longer than usual, even after you fasted. This can potentially cause severe pneumonia or lung injury, respiratory failure, and even death. So, for this reason, it's very important to tell your doctor that you're taking a GLP-1 before you schedule surgery. Lastly, let's talk about what is known as Ozempic face. While it is called Ozempic face, all of the GLP agonists can cause this side effect, which is a noticeable loss of facial fat. It's a loss of the overall fullness in the face of the patients who take it. There's a hollowing of the eyes, there's a hollowing of the face. You have an increase in wrinkles and fine lines along the forehead, around the eyes, and also around the mouth. You'll notice loose, sagging skin along the jawline and the neck. And because you have this loose neck skin, you end up with a more pronounced bone structure. Ozempic face is a real phenomenon, but what causes it, that's where the controversy is. Many physicians don't feel like the drugs themselves are causing the Ozempic face or the hollowing of the face. What they believe is that the rapid weight loss is what leads to the hollowing or the loss of fat in the face. And that's because you're losing weight so fast that your skin is not having time to adjust. But it's not the actual drugs themselves, but it is an extension or a result of the rapid weight loss. But nevertheless, it is real. All right, I believe that we covered the things that I would want to cover, and I hope you learned something from this video. Thanks for watching. Remember, if you have any questions, please put them below in the comments. I can't wait to read them.